All right, we are live. So, welcome and thank you everyone for being here. My name is Renee Fabian, and I am the features editor at The Mighty. And today I am joined by Vernon Price and Victoria Smith, two wonderful patient advocates. And so, before we get into introductions, I will let them introduce themselves. Let me tell you a little bit about what we're doing here today. So with the support of a USC California fellowship through the Center for Health Journalism, I've been working on a project the last 6 months on mental health parity. And then I've been looking specifically at the difficulties of using private health insurance to access mental health care services. The eventual project that I published, we'll drop the link in, focused largely on outpatient therapy, but obviously access to mental health care issues are certainly not limited to just outpatient therapy. And so to talk about that from the patient perspective, I'm joined here by these two lovely advocates who are willing to share a little bit more about their experience. And we'll talk a little bit more generally what patients should know, what are some of the biggest challenges, and then also some ways really that might be helpful for other patients who are facing these challenges and how they can advocate for themselves. So that is my spiel. And so Vernon and Victoria, I'll let you introduce yourselves. Who would like to go first? I think it's you, Victoria.
All right, sounds good. So my name is Victoria. I am currently an MSW student at the University of Southern California. And I was inspired to pursue social work and specifically therapy because of my own experiences in the mental health field.
Excellent. Thanks, Victoria. Vernon, you're up.
Well, my name is Vernon Price, and I am a social advocate activist for homeless and or unhoused citizens in our state, and a mental health advocate. I am a part of Access California, and have been a part of the Behavioral Health Board here in Humboldt County for some time. And I am just very much looking forward to being an intricate part of improving the quality of life, building a stronger community in a more vibrant state that we all live in. And it's very essential to show the need for mental health services in comparison to our physical health. It should be treated just as equal. So thank you so much for giving me the honor and the privilege of being a part of this, and looking forward to being a part of this. Thank you.
Thank you, Vernon. Yeah, it's so great to have both of you here. And for those of you who are not from California, the project's focused specifically on California. So something else that's helpful to know, Vernon is up in Humboldt County, which is in Northern California, and it's a more rural area of the state. And then Victoria, you're in Southern California, correct?
Yeah.
Okay. And then Victoria and I are both in Southern California, which is very different than up north. Okay, so let's get into it. So I thought it would be kind of helpful to set the stage as patients to talk a little bit about your personal experience accessing mental health care. So I can share that one of the reasons that I wanted to work on this project, particularly the difficulty of using insurance for therapy and the need to pay out of pocket, is because I've been paying out of pocket for therapy for quite a while now, which is obviously a privilege to be able to afford that. And it's very expensive. So that's kind of where I'm coming from as a patient, needing all of these services and then not being able to find a therapist who fit what I needed using insurance. And then the last couple of therapists, I haven't even bothered. But again, not everybody can do that. And I think mental health care should definitely be a lot more affordable. So that was kind of the inspiration behind this project. And then I've heard a lot of stories from other patients as well, including both of you. So if you're open to it, do you want to talk a little bit about your experience accessing mental health care?
Victoria, I would like to give you the opportunity, ladies first, to lead this off.
All right. My passion for mental health insurance parity and all of that came from my experience as well. I done outpatient therapy out of pocket, but it was much more affordable when I was an undergraduate student using like the student health services. But when it became clear that I needed a little bit more help than they could offer me, it was just not in any way financially feasible to be able to pay for that on my own. And then as well, you need referrals and things like that, and that comes from insurance. And so I spent many, many, many months fighting with my health insurance, asking for care, asking for them to take me seriously. I presented as like a high functioning patient, even though I was really, really struggling. And so having to fight for that care was really, really hard.
Yeah, absolutely. And I think sometimes I've had some other people talk about this as well, where it's like you're perceived as like high functioning. So in some ways that makes it more difficult to get care. And, you know, as somebody who really knows the system well and who could advocate for yourself, that's the thing I've heard a lot as well, where, you know, even the most informed, best informed people have a really hard time navigating the system, which makes it obviously so much more difficult if, you know, you're kind of new to the mental health system. So that advocacy that you've been able to do for yourself is really impressive.
Thank you. And it's like when you're in that place where you need like more care, it's like just even that much more overwhelming to be told that like you don't need the services that you're actually requesting and things like that. So yeah.
Yeah, that certainly does not help your mental health. Vernon, do you want to share a little bit about your experience as well?
Thank you. And Victoria, that is such a very powerful and effective statement that you've just said, because me being a part, or myself being a part of a state advocacy group, along with our behavioral health board and our human rights commission, you know, I'm just going to give you a little history of my past. I am the former drug addict of methamphetamine for over 6 years, with 6 years now clean. The former homeless person of 15 years, a man at 50 years of age now with 3 type 1 diagnoses of post-traumatic stress disorder with paranoid characteristics, suicidal ideations, with 2 past attempts of suicide, along with social anxiety disorders. So, with all of that said, I am now able to manage my mental illnesses instead of it controlling my life. And recovery is possible, wellness is possible. But see, we face another difficulty or an obstacle that we can definitely turn into an opportunity, that the high functioning. To me, that is a backhanded compliment, such as you are very well spoken to be a person with mental illness. These are the comments that we need to educate the community, and that's what we're doing here today. I am deemed as, you know, same thing, high functioning. I was actually declined services through the private health sector. I'm not going to, it was a very good insurance company before I became on the public mental health system. And I was denied mental health care because of being deemed high functioning. But that was still a part of, or it is still a part of, the public mental health system, that we are deemed high functioning because, and this is the reasoning that I get from different, health plans, is that the priorities are deemed with the physical problems instead of the mental health problems. We are easier to get specialists, like with a broken arm or with kidneys, or, you know, stuff of that in the physical recovery realm. But we need to show the necessity. If we are going to have recovery sustained, there must be an importance put on, and an emphasis put on the mental health, without being told, or without the break of care. Um, because in that time that we have brokenness of care in between private insurance companies and public mental health systems, we tend, and I speak on the behalf of a lot of people, we as the consumers, the patients, or the stakeholders, um, relapse from our recovery into our old mindset and mind patterns, that we're not worth the insurance or the time needed. So this is the time for a paradigm shift, if I may say, of the necessity and need for mental health treatment. Thank you.
Yeah, absolutely, Vernon. And I think you make a really good point that our healthcare system is particularly, it's like we wait for people to kind of fail first or need like emergency services. Whereas if we helped people get services sooner and backed up higher, you know, then perhaps we could do a lot more prevention work, which is, I mean, it's important in physical health, but I think almost more critical in mental health. And there's a lot of research that suggests if you're addressing mental health needs, that also lowers the cost of physical health care, which in a for-profit system you would think would be a little bit more valuable. So that's such a good point that you bring up, Vernon.
And if I may, and I'm not trying to manipulate or monopolize, but I think that this is a crucial piece where those of us that are uh, participants or consumers of mental health providership, whether it be from the private realm or the public health realm or public mental health system, um, we in the long run choose, a lot of us, to become peer coaches or to help people along their journey of recovery. And this is what they call pay it forward. And in the long run, it's an economic savings, not just to our county, one of the, what, 58 or 59 counties that we have in the state of California, but it will also save the general budget in the state because of the volunteer hours that we help other people help themselves on the road of recovery. So I think that it's beneficial, not just for the mental wellness of it all in recovery. If we look at the financial aspect of it, we can find that we, in the long run, save hard dollars that can be rejuvenated back into our general plan and our budget.
Yeah, definitely. And in that case, it's a win-win for everybody. We have people who are healthier and able to sustain their recovery, and it costs less money, basically. Okay. So the other thing I'm wondering, I know you've both talked a little bit about your journey from a higher level, particularly with accessing care. What were some of the biggest challenges that you faced trying to get insurance companies to pay for the services that you need? Not to put you on the spot, Victoria, but I know we talked a lot about this as well. Some of the hurdles that you really faced, and how you really battled against that. If you want to talk a little bit about that, if that's all right.
Yeah, so when I realized that I needed a higher level of care beyond just like weekly therapy, I realized very quickly that the system has a particular way of running and you have to figure out the rules of the system, but they're not going to tell you what the rules are. And they're not going to help you in any way to figure out what the rules are. So it's really just a guessing game to try to figure out, okay, how do I play this game right so that I'm receiving the services, but not too much and not too little. It's a whole thing. So for me, I started out by calling the psychiatry department at my insurance company and saying like, hey, my doctors are saying I need more care. How do I go about this? And I ended up being placed in a lower level of care that wasn't appropriate. And things just really went downhill from there. And so I ended up choosing to go to the hospital, which was really hard. And it was scary, but it was worthwhile because it got their attention. It was like the piece that was needed for them to take me seriously, as frustrating and sad as that is. And then after that, I was able to receive services, and then they got very quickly cut off. Like I was told day of that I wasn't able to receive services anymore. And so at that point, I had been put on disability, and was feeling very lost and really overwhelmed and just didn't know where to turn. And so I kept calling my insurance over and over and over again. And finally, I got paired with a psychiatrist who had the power within the system to put me in another program. And then I was in more, and it was just a lot of having to keep calling and keep asking. I had to file an appeal to my insurance company and then to the Department of Managed Healthcare as well. I had to give testimony before a board, and I had like 10 minutes to prepare. It's been a very long journey, but I'm grateful that I'm still here and I'm still fighting. So, yeah, I don't know if that made sense.
Yeah, absolutely. Yeah, and thank you for sharing that. And I mean, obviously, we're very glad that you're still here. And yeah, the level of persistence that it takes. And it sounds like, it was finding that one psychiatrist in a position of power who was really willing to help you. It sounds like that was maybe one of the more helpful things, because it sounds like there were a lot of people weren't listening to you as a patient,
Yeah, it was like, oh, well, you look fine. You're still functioning. You finished college, things like that. So it's okay. You're doing okay. I was like, no, I'm really not okay. Look at these measures that we use to determine mental illness. You're ignoring these because I'm presenting in a way that's incongruent. And so that was incredibly frustrating.
Yeah, absolutely. And it sounds like knowing some of like the language that they're used to hearing, it sounds like I'm hearing like congruent and all of that stuff. It's like that, like learning to speak their language also sounds like a part of the journey.
Yeah.
Thanks, Victoria. So, Vernon, I want to turn the same question to you. What have been some of the biggest challenges you faced accessing care?
Being heard about the severity of my diagnosis. And I'm not trying to be narcissistic or self-centered. When I say I'd rather just say myself as a benefactor or as an example than to throw someone else under the bus, because there are more people going through this than there's even data collected. Because there's a lot of us. I was in fear for 5 years while I've been in treatment and in therapy and dialectical behavioral therapy and cognitive behavioral therapy, cognitive interviewing. And the thing of it is that, well, you look mentally healthy. But they don't know about the nightmares that the stuff that we go through. I mean, our closet that we go through, because I deal with the fear of being judged, ridiculed, and getting over that is the first obstacle. But once that obstacle is turned into an opportunity, not just to be heard, but to communicate with our treatment team, that we as the patient or consumer or stakeholder um, are encouraged to participate in our treatment. And then the second obstacle that we faced is the jargon, and learning the alphabets behind everything, like LCSW, MSW, and our State Oversight and Accountability Commission. I can't remember the abbreviations, but learning the jargon, because if I'm going to properly communicate to a psychiatrist or a therapist, I need to take the initiative of learning their language. Okay, it's like me coming out of homelessness, and the vocabulary that we use, like homie or stuff of that nature. And I was a part of that system. So all of that said, uh, what we are hungry for, we feed. If we're going to be an active participant in our recovery process, we need to be hungry for learning the language and learning the ins and outs. But I feel like that a lot of times that our needs are overlooked, not necessarily on purpose or intentional, but it's because you look so well, you look healthy, you appear to be cheerful. Let me give you a case in point of a gentleman, a very, very well renowned and very well respected comedian and actor, and one of my personal heroes, Mr. Robin Williams. Okay. A lot of times, those of us that deal with mental illnesses, we hide behind the comedy, we hide behind the humor. And it's not making light of our mental illnesses. And that's our way of showing that, okay, we're trying to recover and I'm trying to be what you tell me to be. I look normal. Um, so these are the challenges that we face, or I face, as a participant of our public mental health system and the private system. Uh, and these are obstacles that really need to be turned into opportunities. And we can all be an intricate part of making that happen. Does that make any sense whatsoever?
Yeah, absolutely. And I think also what it sounds like maybe as an extension of that, Vernon, is that there's, and I think this is something that both of you talked about, it's like there's a disconnect between the people who are in charge of delivering or paying for care, I should say, and then patients and what the lived experience is really like. It sounds like there's a mismatch there, and the responsibility is on the patient to kind of rise up and speak in this language and figure out how the system works when the burden probably shouldn't be on the patient. I'm wondering if you have thoughts about that.
Was that directed toward me or was that directed toward Victoria?
Both of
Or both? Okay,
you.
Victoria, you go ahead and take the lead.
Yeah, it feels like it's definitely on the patient to be like, okay, these are the problems I'm having. Please take me seriously. Please take me seriously. Who do I need to talk to? And who's in charge of that person who I can talk to? Because it feels like within the system, there's the providers that you're seeing, and then there's like the utilization review team who you'll never see and cannot talk to. And then there's like management, and you'll never talk to them either. And so there's all these like systems in play that are never going to see you and who are making decisions about where you're getting treatment, if you're getting treatment, what level of treatment. And so, yeah, it's really difficult.
Yeah, that's such a good point about the disconnect between the people who are making decisions about your treatment and then the people who actually, provide your treatment. And I've heard from a lot of therapists as well that, their opinion is also disregarded in a lot of these cases.
Yeah, they'll even state like in their notes about the patient, like this is what I'm recommending, but it doesn't seem, the utilization review doesn't agree, even though they've never met the patient, or management is saying, oh, this is too expensive, or you need to be better by now, even if you're not. And so, yeah, there's definitely a disconnect.
Yeah, like these arbitrary timelines. Yeah. Thanks, Victoria. Additional thoughts, Vernon?
Well, that's very difficult to follow that one. I mean, you hit it right on. I mean, right on the spot, Victoria. The only thing I would like to amplify on that is not just changing things at a local level, because our directors of our mental health cares, and even the billing code system that private therapy, therapists and psychiatrists must go adhere, or what they call SOP, standard operating procedures. This is where the therapist and the psychiatrist is getting they really want the recommendations for their patients, like Victoria and I and others, to live the best day in life possible, and they just cannot get the right medications because it's not covered by their billing system, and this is where the quality of care is usually bogged down with what we call the bureaucracy in politics, in the coverage of care. Um, so that's the only thing I would like to add, and no one could have said it better than you, Victoria.
I agree with Vernon. Um, so I'll direct this at you first as well, Victoria. And you've talked a little bit about this, about some of the appeals that you had to file and finding the psychiatrist and calling over and over again. If you had to instruct another patient on what to do to navigate what they needed, what are some of the tools that you might point them to?
So one of the things that I tell people is that it's really important to know your rights, especially if you're inpatient, like in a hospital or something like that. So I have mine on hand because I'm that person. But in the state of California, there are specific laws and rights that you have as a patient, whether you're voluntary or involuntary, that are the law. It's something that is your right. And so a lot of times, in the interests of making things easier for the staff, they will ignore rights. But these rights are really important to patients because when you're in the hospital, you need every shred of dignity that you can get, every shred of self-worth, every shred of like normalcy, because things are just really not normal. And so knowing what your rights are empowers you to be able to say, hey, this is not being provided for me, or I'm being held longer than I should be. Things like that. It's really helpful. And it's written in a way that's pretty accessible, which I really appreciated as well. Another thing is to read everything before you sign it. It can be hard because they give you a lot of paperwork, and sometimes they'll give it to you at like 2 in the morning when you're not awake. And so you are allowed to say, I want to sign this at another time. You're allowed to deny particular treatments. So yeah, knowing the things that you can say no to, knowing the things that are going to help you is super important. Another thing I would say is to be persistent or annoying, and to just keep calling and keep asking for what you need. And if that person isn't helping you, then ask to speak to the person above them. And again, if they're not listening, then you ask to speak to the person above them. And eventually they get annoyed and they just kind of give you what you need. And so you kind of wear them down, and eventually you get what you need. So even if that means like, hey, I'm going to file an appeal with the state, and then that's kind of scary for them to hear sometimes. Using things like that. Filing a grievance with your insurance company first can be helpful. Recognizing power structures and how they work, which can be complicated. And then another thing I was thinking about is writing down your symptoms and problems that you're experiencing and having that on hand when you have these conversations, so that in the moment when you're feeling flustered or overwhelmed, or they're trying to convince you that it's not a big deal, that you know, like, these are the things that I'm experiencing and my experience matters. And it matters that I get the care that I need. And keeping records of your interactions in case you need to have a appeal. That was a lot of information. Not sure if that all made sense.
Yeah, it definitely made sense. And I think that's really powerful and helpful to know, especially, some of those rights. It's like people, they're given a form and it's like, you must sign this form, but knowing, those rights, it sounds really important. And yeah, just having that written down. And when you said, like, my experience matters, and you deserve that care, like, that's really powerful. And it sounds like it's something that gets lost when you're dealing with this whole system.
One of the phrases that I held on to when I was in the thick of it was like, I am worthy of the care I need to step into who I'm becoming. And just like, I would repeat that to myself, like day after day, like I am worthy of the care that I need. And that helped me to be like, okay, I just need to take the next right step. And what does that look like today? And sometimes that means just getting out of bed and brushing my teeth. But other days that was like, okay, I'm going to make that call and it's going to be hard, but I can do this.
Yeah, that's so powerful. And like very clearly comes from the place of, someone with lived experience, which seems like is kind of missing in some of these structures. And, what I love about the way that you talk about this is that it's very accessible to people who do have lived experience, because when you're really struggling, a lot of this is also really hard to do. Thanks, Victoria. Vernon, same question to you. What are some of the tools that you found most helpful?
Well, like Victoria said, we must be persistent because there's going to be a lot of times that uh, um, we just want to give up because of the lack of interest of being heard that these are the symptoms or side effects that I'm having from certain medications, or I'm not getting uh, the effects that I need out of the treatment or groups that we're involved in. Well, it's helping other people. Not everyone's recovery and treatment needs to be cookie cut. Because everyone's going to recover different and everyone is going to need a different baseline of treatment. I also believe in utilizing our PRA, Patients' Rights Advocates, that is mandated by the Welfare and Institution Code in the state of California, that every county have a patient's rights advocate for their public mental health system, and every insurance corporation is required by Welfare and Institution codes to have a PRA on their staff to assist people with knowing what their rights are. In the state of California, we have a 5150 involuntary commitment. We have a 5250 involuntary commitment. And me being a patient in an inpatient facility under Thorazine and other medications that I'm drooling from the mouth, and I can't really keep a mind frame of carrying on a lengthy conversation, we need to have those people to advocate on our behalf at any given notice or without notice for that matter. Because at that time, it's extremely difficult to be able to be taken serious because at that time we're under medications and inpatient treatment, and we can't be understood because our words are slurred and stuff of that nature due to the effects of the medication. So utilizing our patients' rights advocate of any county, I think, is crucial. To finding a baseline of the right treatment plan for us, and taking no for an answer is not an option. And uh, sometimes we may be deemed as a nuisance, or uh, you know uh, we just have to be, and this is something we need to overcome as a systematic of care. This needs to change, and until we can have forms like we're participating in today, and not just educating the community in a live broadcast, but that empowers a community with education that we can be part of a community and part of a system of care and joint change. When I say joint change, I mean positive change, but utilizing ourselves, our treatment team, and definitely our patients' rights advocate. Uh, I think that would be a good combination. And definitely what Victoria said, um, moving forward and pressing through.
Yeah, definitely. And I think something I heard both of you say, like Vernon, you said nuisance, and Victoria, you said like annoying. It's like in this context, like those are very positive traits and ones that are like very necessary, like in the most positive way.
Even now, as I advocate, and walk with people through their road of recovery, Oh no, here he comes again with someone else. Yep, we're here and we're not leaving. Okay, we're going to utilize your chairs. I don't care if they're out to lunch or this, that, and the other. We'll be here when they get back. But just politely sitting here. That we may get called some things, but the thing of it is that it has to be done, and and it's shameful to say that.
Can I add something onto that? So we've talked a little bit about treatment teams, but I think it's important for mental health patients to know that you are part of your treatment team too. Like, we may not be in the treatment team meetings, but you are an essential part of your own care. And so knowing what your medications are, understanding why they're being prescribed, asking questions, asking for care that you need, like those are all really important things. And knowing that you're part of the team too, I feel like can be empowering to realize that your voice matters and what you have to say matters.
Yeah, absolutely. Because too often it seems like patients are kind of left out. And then, as you said, like knowing those patient rights is really important. Vernon, go ahead.
Yes, I should have been clearer or more clear when I mentioned that, because without the patient's participation in their treatment process and jointly with their entire treatment team, and when we say a team, we're talking about a psychiatrist, a therapist, a case manager. Uh, Without our participation of saying what we need to have a better quality of life and a more positive outlook of the goals, we must be participants in that treatment. That's we're stepping up to the home plate. We're wanting to hit a out of the park home run, but that can't happen until we as consumers step up to the plate and overcome that fear of speaking with our team. We have to be vocal in those meetings.
Definitely. Victoria, I'm wondering if you could talk a little bit more about, I think people will definitely be in agreement that, like it's empowering to be included on your treatment team, but sometimes it can be hard to know, like, what do you say to sort of tell that to people who maybe aren't as willing to sort of open that door. Can you talk a little bit about that? Like, what is the most effective way to sort of remind other people that as a patient, you're part of your treatment team?
I think that there tends to be a fear of being judged or as coming across as pushy, or there's like different fears that come with speaking up, being afraid of not being taken seriously, things like that. But just like, I don't know, like reminding a friend who's looking for mental health care, or reminding yourself that like what you have to say matters, and these people are here to help you. And sometimes they're not going to go about it in the best way, and sometimes it's going to take a little bit longer for them to understand. But to just keep going and keep asking, because it matters that you get better, and it matters that you get help.
Yeah, absolutely. And like that message is in a lot of ways very simple, but one that, as like patients, we don't really hear often enough sometimes in this whole structure. Just the way that, in a for-profit system, it's like we put a price tag on people's health and well-being. And that's a really kind of difficult place to come at it from, especially when it's like very clear to you that it's like, I need help and this system is supposed to help. And here are 101 hurdles you have to get through first. Okay. So taking this a little bit further, what do you think, if we could change sort of one big part of the system, what do you think would make the most difference for patients right out of the gate? It's sort of a big question, but I think that you probably both have some ideas.
So a couple of things came to mind for me. It would be really helpful if insurance companies gave you an instruction manual about how they worked. Like, instead of just having to guess and figure out what is going on, if they just told you, like, okay, these are the steps you're going to need to go through to get care, and you could make a little checklist, that would be fabulous. Another thing is if, like, the people who are making decisions actually met with patients and saw the people that they're making decisions about, or at the very least, if they were accessible. I remember when I was talking with my insurance literally daily, sometimes multiple times a day, I was like, can I please just talk to the utilization team? Like, please let them just hear from me. Like, and I was not allowed. They were like, we don't even have a phone number for them. Like, it was not even possible. And that blew my mind. Yeah, so I think also I didn't know, even today, I didn't know that I had access to an advocate in my health and care insurance. I knew that was allowed, like, when you're in the hospital, but I didn't know that I'd had access to an advocate, and that would have made a difference for me.
Yeah, I just learned about that advocate thing today too. Yeah, and it's like, can you please explain how this works, and also, like, look at my face and, meet me. Like, these things that seem really basic.
Yeah, and see me as a human being who is struggling and isn't defined by the diagnoses, but who's really hurting and needs some support.
Yeah, definitely. And, like, that doesn't seem like too much to ask, really. Yeah. Vernon, can you show us your binder again?
I'm trying to find my mute button without glasses, so I apologize. Miss Victoria, be careful, my friend, what you ask for, because this binder right here is I can't find my camera now, but is actually 3 inches thick. And I got this from our mental health insurance carrier. Okay. And yes, it shows treatment plans, options of treatment plans, depending on what type of diagnosis you have. No, I'm ready to give it back to our insurance carrier, let me tell you. But I should have never opened the book because I'm confused. I'm confused at birth, okay? And I'm still confused as an adult. This binder is to the 25th power. But if we could simplify the information or get it simplified from the insurance carriers, I really think that would, any kind of education, and reading things is educational, and it's very empowering. And I really think that should be a crucial part of our treatment, is because learn about your diagnosis, learn about the options of treatments is for that certain diagnosis. And sometimes we need to stand up to our mental health administrators, our case managers, and even the insurance. This is not right. And sometimes, anyway, I'm sorry, I'm getting on a roll here. Renee, can I get you to, and I apologize for asking you to repeat yourself, can you repeat the premise of this question here?
Yeah, sure. Absolutely. So if we were going to change, or had the ability to change one thing about the system tomorrow, what is something that would make maybe a really big difference as a patient?
3 things, if I may. I'm worthy of treatment. Okay, we are worthy of treatment. And number 2, we are feelings. I'm sorry. We are human beings with feelings and emotions, and sensitivity, and we should be treated as such. Okay, that's just the common basics of life, and the need of being heard, of what we're going through. Well, you may be going through this, your therapist says, but it's a stemming of this. A lot of times things are more simplified when they shouldn't be. And being taken serious about our issues, regardless, whether it be I apologize for the briefness. I lose my train of thought because of my mental illness, and that's the reason why of the extensiveness of quietness. I'm going to go ahead and just uh, leave it at that because I'm starting to ramble, but I'll leave it at that. Thank y'all.
Thank you, Vernon. And yeah, I mean, I think that's very powerful too. And, you both kind of said the same thing where it's like, I'm worthy of care and please see me as a human, whether that's access to your utilization team or, just when people look at you, they see a human and not just a diagnosis. Go for it, Vernon.
I just remembered. So you triggered my thought. We are not minimized or to our diagnosis. We are stronger. We are more than our diagnosis. Our diagnosis is just one piece of the puzzle of who we are. Okay, and that's what I forgot. So thank you.
That's a wonderful addition. Okay. So we're coming up on time here. So I'm wondering if both of you could kind of leave us with some of your wisdom, which probably sounds like a very high pressure sort of a thing, but as patient advocates, and then Victoria, as a future clinician, what do you hope that other people take away from, these conversations about access to care and, where we're going in the future and what it means to live with a mental illness, and, sort of this view of the future, like what could it look like? What could it be like? And what should it be like, really?
I think I want people to know that it matters that you're here. It matters that that you're seen and that you get the care that you need. That you aren't a burden. That even when the system makes you feel like, oh, I'm a burden, or oh man, they're gonna have to listen to me again, that it matters that your voice is heard and that it's here. That you are worthy of care. Again, you're worthy of care. You deserve the care that you need, and to keep being annoying. Keep being annoying and keep asking and keep being persistent with it, because it matters that much that you're here. And I know that it's really, really hard. And sometimes you're just going to have to take it a day at a time. But yeah, I don't know. I'm starting to tear up, so I guess I'll leave it at that.
That's really amazing, Victoria. Thank you. Vernon, same question to you.
How much time do we have? I'm long-winded. I'm sorry. That was kind of a joke. I think if I was to, I don't know where this broadcast is going to. It may be going worldwide. It may be going nationwide. It may be going statewide. I don't know. But in the state of California, a Senate Bill 855, I want to give everyone a little bit of homework that's under the sound of my voice. Google California Senate Bill 855, and it's showing the importance of the treatment of mental health and the equality that mental health stands in alongside of the physical health. Because if mental health is not treated as equal and as necessary as our physical health, our mental health will work on negatively our physical health. Okay, what I mean by that is my paranoia many years ago ran rampant, and it caused me to have a heart attack because of my blood pressure and my respirations. And so it's because the importance was not put on the treatment of mental health diagnoses because it wasn't a physical issue. If we would learn to treat mental health as serious as we treat our physical health, this is where holistic care comes into play. Treat the whole person in full service around the individual, not just their physical, but their mental. And then we meet it in the middle. And that's what brings the whole person to being well, not just physically well, but mental wellness is possible. And it is doable along with the treatment of physical health. So, treating mental health as equally and as necessary as physical health will be the premise that I say is the most important. Not minimizing what Miss Victoria said, because that is very much true. But until we treat the mental health as equal as the physical health, we will get holistic care.
Yeah, definitely. And I think really those things work together. You know, you're worthy of mental health care, and that equality is so important because, you know, your mental health impacts everything, really. Okay. So I think we can probably wrap it up there. So I will say that we'll drop the link to the article on mental health parity in the chat, a lot of which was informed. I've had the opportunity to talk with Victoria a couple times and Vernon as well, and I have learned a lot from them. Then in addition, in the next month or so, the other thing that we're doing is putting together basically like a guide for patients on, you know, some of these different things that we've been talking about, you know, like what are your rights, where can you learn about your rights, you know, where can you, or how do you figure out, you know, what your insurance benefits are, how do you file an appeal, all of that kind of stuff to start hopefully making Vernon's giant binder of insurance information and, you know, some of the things that you kind of learned by trial and error, Victoria, hopefully make that a little bit more accessible so people have like a little bit of a compass or a roadmap. So that being said, Victoria and Vernon, I want to thank you so much for joining me for this conversation and for sharing so much of your journey and for being such wonderful advocates. It's been really amazing to get to know both of you, and I'm really glad that you've joined me here to share some more of that with a bigger audience. So thank you so much for coming.
Thank you for allowing me to be here. And Victoria and Renee, it's been a very honor and privilege to be able to share this moment in time in a very positive and very productive, on a very sensitive and serious subject that people can learn together instead of, you know, work against each other, move forward together. And it's just been a very honor and privilege to be here today. Thank you.
Thank you. And thank you so much to everyone who's listening as well. So happy Friday and have a great weekend.